Welcome to the World Congress of Metabolic Medicine 2019 Mumbai. I have a pleasure to introduce you to Dr. Amal Banerjee, who is a consultant cardiologist and interventional cardiologist. It's really difficult for me to summarize his designation and all the things that he have done in few words, but I'll still try my best to forgive me if I'm getting wrong. So he is basically a Dean of Indian College of Physicians. He's a past President of Cardiology Society of India, and you say it, you name it, and here we are. I just want to know, are you presenting something in the Cardiac Metabolic Medicine Congress?
Oh, of course. I have the issue of discussion, the heart failure with preserved ejection fraction. Nowadays, heart failure with preserved ejection fraction is an important issue that emerging as there are so many cardiovascular risk factors, and also the aging. There is increased incidences of heart failure with preserved ejection fraction. So, what is the problem with the comparison with the reduced ejection fraction and the preserved ejection fraction? With the reduced ejection fraction, we have some definite treatment, but patients with preserved ejection fraction, we do not have any definitive treatment except lifestyle modification, control of the risk factors, and when the patient is having excessive shortness of breath, to reduce the congestion of the lung, we have some diuretic treatment. Apart from, there is a control of the risk factor I have mentioned earlier.
Yeah.
So, what is being now we tell that the control of the blood pressure, control of the atrial fibrillation, weight reduction, control of your obesity, and also the glycemic control. These are the few things which are very much required for the control, or rather prevention. We know in this the heart failure with preserved ejection fraction, prevention is much more important than for the specific treatment.
So if I may ask you, what are the commonest things that can lead to the heart failure with preserved ejection fraction? Can we just summarize few things, or that we should keep an eye on that things ABC can lead up to the
first,
problem?
I should keep it the hypertension, then atrial fibrillation, obesity, coronary artery disease. These are the most important risk factors which can lead to heart failure with preserved ejection fraction.
And what are the symptoms that should be watching for, how the patient usually presents?
Heart failure with preserved ejection fraction, if we measure the systolic function, which is echocardiographically measured as a ejection fraction, here the ejection fraction is more than 50%. But the patient having the clinical sign and symptoms of heart failure, all of us know the heart failure is a clinical syndrome. So, a patient with features and sign symptoms of heart failure, but where the systolic function is normal, that is more than ejection fraction is more than 50%, that is with the situation we call heart failure with preserved ejection fraction.
So is the treatment modality different as opposed to the heart failure with reduced ejection fraction? Do you have the same treatment, or is there something different that has been noticed?
Actually, since heart failure, the reduced ejection fraction, it has got some other etiological and perpetuating factors, but heart failure with the preserved ejection fraction, causes are not definitely known, exact pathophysiology is not exactly known, only we have the features. So, when, as I mentioned earlier, that when there is a congestion in the lung, then we have the diuretic therapy, that is reducing the water overload in our body, that is common with the reduced ejection fraction, but other things are not so definite like the management of heart failure with reduced ejection fraction. So, best thing is to control hypertension, to control atrial fibrillation. If the patient having the ischemic load, then we should try to revascularize the patient, or is a stable coronary artery disease, to treat him accordingly and the optimum medical therapy. Then comes the reduction of weight, obesity, correct diet, regular exercise. These are the things which may to some extent alleviate the symptoms of the heart failure with reduced ejection fraction.
So if I may ask you to summarize your talks in few sentences, like number A, focusing on the etiology of the HFpEF, number 2, the symptoms, and finally the treatment. Just key home message or bring back message for us, please.
Heart failure with preserved ejection fraction usually is a risk factor dependent, just like the hypertension, atrial fibrillation, coronary artery disease, obesity, diabetes, all these things. But so far as the management issue is being concerned, it is not, no specific treatment is there till date, but only to reduce the water overload or fluid overload in the body, we can, which is similar to the reduced ejection fraction, we can use the diuretic. But one important more thing which is emerging, that patient with the left ventricular dysfunction, this patient in the sometime in course of their reduced ejection fraction, there is a involvement of the right ventricle, and it has been observed the deterioration of the left ventricle compared to the deterioration of the left ventricle, deterioration of the right ventricular function is faster, and those patients who has developed deterioration of right ventricular function, fair enough, and there is a increased mortality in particular that group of patient. So, prevention, detection at the right time, control of the congestion and all these lifestyle modification, these are the cornerstones for the management of heart failure with preserved ejection fraction.
Thank you. Summarizing,
Thank you.
you have summarized it very nicely for your talks, and I wish you good luck for your talks tomorrow.
Thank you.